universal health coverage. I think December 12th is the World Day for Universal Health Coverage. And in Nigeria and across the world, it's been about how to be strong, how to be healthy, and all of the issues. But awareness has been driven up. And so this year, the theme is Keep the Promise. And the question is, why are you laughing? The question is Nigeria keeping the promise?
That's the question.
Has Nigeria actually promised? Is healthcare promised?
Ali, it is promised. All the campaigns, all the different campaigns are different.
No, see, when you say campaign, then you've cancelled promise.
I said,
once it's campaign, it's no more promise. So if during the campaign you heard health will be provided, it's a gimmick.
You misheard.
Yeah, you misheard. So it's and that's very campaign is not healthy.
but that's why we have people like this who are doing the things. The people you're about to introduce.
So Serah Makka Ugbabe, the country director, one campaign is in Abuja, and will be throwing light on this issue. Hey, welcome, ma'am. Merry Christmas.
Thank you. Merry Christmas to you too.
So today is universal health coverage. So today is the day for health. So talk to us about this.
So, you know, the 12th was the day that we all looked at universal health coverage. And I think your question is, did Nigeria ever promise? The answer is yes. About 7 years ago, Nigeria promised. What did Nigeria promise? Nigeria promised quality, accessible, affordable health care. So that's the promise. Quality, accessibility, and affordability. But from what we're seeing today, Nigeria is not keeping her promise on all three, on quality, affordability, and accessibility. So I think what we have to do is, what's new today? What's happening? Where is Nigeria almost ticking the box on that promise? And I hope that we can share more light on that today.
Too that we can. I mean, if it's taken 7 years, and within those 7 years, we probably had 1 or 2 elections, and we do know that during elections, politicians and leaders at different levels talk a lot about what they are going to do to improve health care. We have primary healthcare development agencies spread across the country. We have primary healthcare centers. We have secondary healthcare centers. We have tertiary healthcare centers. But at the end of the day, a promise made 7 years ago. You who's been working with the different levels of the healthcare delivery and all of that, tell us what you've seen and at what level do you think that these areas are being ticked off on?
So I think you're right. We have so many tiers of government: primary healthcare, secondary healthcare, tertiary healthcare. There are two things. One is, 7 years ago, we've had many campaigns. You know, one of the things Ali Baba said is, when health is mentioned on the election trail, it's not really a promise. Let me shift that a little bit. I think that citizens, we have a lot more power than we are expressing. So when health is mentioned on the campaign trail, we need to hold it. And the next campaign, we need to decide whether that person is coming back based on how they did on healthcare. So that's the first thing. I think that citizens, our power is greater than we know. And that's something that we have to keep doing. 2023 is around the corner. How does each party fare on healthcare, on keeping that promise? Now, there is good news. I think sometimes when we talk about healthcare in Nigeria, it's all bad news. Things are bad. You know, Nigeria is the worst place to have a baby. 58,000 women die every year on child-related and maternal-related issues. It's one of the worst places to be a under 5-year-old. Every day, we have 2,300 children under 5 dying. You know, if it was a plane crash, we would say that we had about 20 plane crashes every day. Nigeria will stop and say, wait, there's an emergency, we're not flying again. But this is what's happening in health. That's how many people are dying every day for healthcare. So that's where we are today. What happened about 10 years ago, actually in 2014, the National Health Act was, passed into law. Now, sometimes citizens are like, what's the National Health Act? Why do I care? What is interesting about that act is that it helped to cement the healthcare sector. It helped to bring everything together and say, there's so many things wrong with our healthcare. That's why we have these statistics: 58,000 women dying every year, 2,300 under 5 dying every day. Why do we have these things? Because our healthcare is not organized. So the National Health Act organized healthcare. Within that National Health Act now, there was one provision called the Basic Healthcare Provision Fund. And that fund is supposed to be funded by the federal government, and matched by the states. That is supposed to help us provide basic healthcare, and that's primary healthcare. My colleagues at One, we went to the streets to ask Nigerians, what is primary healthcare? We found out that a lot of people, some people know what primary healthcare is, some people don't know. When they have a headache, they go straight to JUICE, they go straight to LUTH, they go to tertiary, which is the highest body of healthcare in Nigeria. That's not supposed to be. You're supposed to go to your primary healthcare, which is close to you, where you live. So what Nigeria did was, that basic healthcare provision fund, we funded it. Sometimes, with issues in Nigeria, we say there's no money. This time it's not the case. There is money. It was funded in 2018. It was funded by $123 million, 55.15 billion naira was funded in the basic healthcare provision. What is that supposed to do? It's supposed to provide some free healthcare services to Nigerians, especially those living in the rural areas. For the first time, you will feel government. Like if you have malaria, you should go to your primary healthcare center with your Huwe card. It's called Huwe. The program is called Huwe, Huwe. With your Huwe card, you should get free malaria treatment, antenatal delivery. Under fives, all their vaccines should be free. If you have an accident on the road, you know how you have an accident on the road, they'll tell you, please, how much are you paying? What are you paying for? That shouldn't be the case with this. They should treat you upon entering the primary healthcare centers. So this program has been built to provide free, basic healthcare to all Nigerians. We'll start with those in the rural areas and the poorest of the poor. So that's where we are today. Okay. Now, it's one thing to have money.
Okay, now there's a correlation between the universal health coverage and the development goals. What is the relation?
Sustainable Development Goals.
Exactly.
So the relationship is that SDG 4 is health and well-being. Nigeria signed that we will adopt that SDG 4 to increase quality healthcare in Nigeria. If you look at the indicators within those SDG goals, many of them pertain to maternal health and child health. Because if you want to tell how healthy a nation's health system is, look at two factors. How are women dying from giving birth? That's one factor. And the second factor, under 5, are they dying? In what levels? It'll tell you that this healthcare system is strong if there are few women dying from child care delivery services, or under 5s are dying. If more women are dying, you'll know that healthcare system is not great. Nigeria has the 4th worst in the world. So the SDG should give us a pathway to address those two things. And this basic healthcare provision is the foundation of universal healthcare coverage, which is also linked to this SDG 4. So that is how we link the basic healthcare to SDGs, to universal health coverage.
So what should we do different?
Importantly, to the average human being, Nigerian.
What should we do different?
They don't care what SDG is. So what should we do different as Nigeria?
Yes, please.
So, two things. One, the citizens need to know that this program exists. They say if the tree falls in the forest and nobody hears it, did the tree fall? If there's a program that exists and you're not asking for it, does the program really exist? So first and foremost, you need to know this program exists and you need to demand for it. When you see your governor, your senator, your house member, your commissioner for health, whether you go to their office, you see them on the street, ask them, is Huwe in my state? It should be in every single state in Nigeria. As we speak, only 2 states have started providing that service, Abia and Osun State. It's the speed of provision is based on how well the federal government is doing and how well the governor is demanding for these healthcare services. So every state should have it, but citizens, you need to put pressure on those states. The second thing is we need to hold Minister of Health accountable, Senate Committee on Health, they need to be accountable. The several MDGs that are related to this, National Health Insurance Scheme, that one needs to deliver for us. National Primary Healthcare Development Agency, NPCDA, also needs to deliver for us. Those two, plus the Federal Ministry of Health, and then the commissions for health in each state, should be in charge of delivering this service. The fact that it doesn't exist in Lagos State, it doesn't exist in Niger State, it's not because there's no money. It's because these agencies have not started working together to make sure it's provided to the citizens. So citizens need to know.
Okay, Serah,
need to demand for it.
Okay, let me come in here. You've talked about the Huwe scheme, and only Abia and Osun have let me use the word domesticated it, that have matched up and it's working in those states, 36 states plus the FCT. But the National Health Insurance Scheme is also on one side, which is supposed to help ensure this whole thing works. But you find out that some states also have their own health insurance schemes. Is it that they're not aware of this Huawei project so that they tie their health insurance schemes to the Huawei project? Or is there something that's maybe like a friction between the two projects, so it's not coming together?
Yes, that's an excellent question. You know, one of the reasons why some programs don't get delivered is this friction, as you called it. There is friction between this national health insurance scheme and the state health insurance scheme. One of the good things that's been done is harmonization and coordination meetings. The federal government has been sitting down with states, because states do have their own insurance schemes, sitting together with states to reduce this friction, to iron out the differences that they have between what the federal government creates and what the state government, what the national health insurance scheme provides and what the state health insurance schemes provide. Ideally, the states and the national health insurance scheme should be in communication. But now we know that there's some issues that they need to work out. But National Health Insurance Scheme already has the mandate to work with state health insurance schemes. So there should not be any friction. Whatever the friction is there, they should iron it out. Because at the end of the day, citizens don't care that one health insurance scheme is not agree with another health insurance scheme. All they care about is, does the service exist so that when my child has malaria, I go to the clinic, it's free and it's provided. That's all citizens care about. So I think the onus really is on the federal government and the state government to harmonize quickly and to deliver this service. This service is very important. And if we don't get it right, we actually don't get universal health coverage right in Nigeria. So this is a moment in history. It could be transformative for us as a nation. And if we bungle it and we don't pay attention to it and we don't address the issues within it and we don't put the right pressure to the right people, we miss an opportunity to actually deliver healthcare for our people, something that is very important, as you know, to all of us.
Serah, you know, there's this UBEC program, Universal Education. And the states are supposed to be counterpart funders of the. What we found out is, because the states know that if the federal government is bringing 2 billion, they have to bring 2 billion as well. States run away from it because they know the funds would then be monitored. And so what they prefer is, let's spend our 2 billion ourselves instead of give it to and gain 4 billion. And so what should we do to go over this, to get past this, where the state doesn't want to bring counterpart funding so that there's no microscope over how the funds are spent.
Trust issues.
Yes. What should we do?
But you know, the truth is that it's not the state governor or government's money. It's Nigerians' money. So again, you're right. What we found at UBEC is we had this fund that the federal government would put money and the state would put money. And we found that some governors and some governments just didn't want to be accountable to the free funds that they got for education. Healthcare faced the same thing. So one of the innovative first things they did was, instead of states coming with counterpart funding, there was a commitment fund that was given to a state. Regardless of how much they contributed, they had to give a commitment of 100 million naira just to start this Huawei fund. And what we found is states are open. Lots of states have started making sure that the fundings go to the TSA accounts. You know, because we learned from education, one of the first things that was put in place for health is transparency of funding. You know, it's when there's no transparency of fundings that lots of stories will start coming. So the money is passed to TSA accounts so there's visibility within the system. So what the federal government asked the states is to provide commitment funding, not quite counterpart funding yet. But I think that's one of the problems with this program, because the National Act actually has a percentage that states should contribute. But to get the program started, you know, the federal government said, okay, let's just start with a commitment fund of 100 million. As long as you put 100 million, we'll start kicking off the process. But I think fundamentally, we still have a problem. There's a trust deficit within the government and the citizens. So citizens really need to pay attention, and they really need to demand for these questions, demand for these funds and these services, or else they will go the way the other funds have gone, and we don't want that.
All right, Serah. We'll take a moment, and when we come back, we'll tidy up this whole thing, what the citizens need to do, what the government all need to do, and those stakeholders in the health sector as well. We'll be back in a moment Please stay with us.
Oh, yeah.
Oh, thank you for staying with us. And we are our closing moments with Serah on this health matter. Serah, please, as we wind down, tell us this matter of trust, states, federal, local government, and the people. How do we rebuild trust so that we can get our health system in shape?
No, trust is really critical, and unfortunately, it's broken between, the different levels of government and its citizens. We have what we call the social contract. The government says, "I'll provide this." The citizens say, "I'll provide this," and that contract is broken between Nigeria and her citizens. I do think that it takes two sides to build trust, and there's responsibility on every side. I'll speak first to the citizen. As a Nigerian, my responsibility is to understand who is representing me. Who's representing me in the House? Who's representing me in the Senate? Who's representing me within my state? And I need to be able to have some kind of information flow between that representative office and my good self as a citizen. We have different organizations, budget, code, that have numbers of your representative. We have ways of getting their attention, but doing nothing is not an option. That's the problem. We can't say, either God did or here we are, we're this powerless citizens in the arms of an all-powerful government. That's not how it works in any country in the world. And it's not going to work that way in Nigeria. So as citizens, we need to be able to hold and call out our public officials. When they do good, we need to call them out and say, "Congratulations, you have done well." When they don't, we need to be able to call them out as well to say, "You have not done well. This project does not work. This thing is not working." We elect them to serve the people. So we have to remember that. For our public officials, and we see some improvements with some public officials who understand that their role is to serve. So accessibility to citizens is important. Obviously, there's 1 or 10 House members in, there are 200 million people. So understanding who your constituency is and getting access to them, communication with them, and also, importantly, transparency. When you turn on the light, you dispel the darkness. So ensuring that there's transparency when it comes to money matters especially. Showing that my hands are clean. The funds you gave for this XYZ, we use for XYZ. That actually really improves trust in the system. A few states have joined the Open Government Partnership. Kaduna State has done that. Kebbi State has done that. And you see, they're committing to partnership between government and civil society so that there's transparency in how funds are spent, how services are provided. We encourage all states to do that because that's a signal that governor is very serious about transparency and that governor is serious about building the trust that is broken between citizens and the government.
Thank you very much, Ali.
So thank you so much. We now understand where the problem lies. Trust. And the trust issues can only be erased if corruption is properly tackled. Beyond that, the constitution needs to be rejigged. I'm not calling for constitutional change, but I just think that once it's rejigged, a lot of. But thank you so much. Thank you for the contribution. Merry Christmas. Have a wonderful weekend.